As more and more healthcare workers are vaccinated each day, it is hard not to wonder when it'll be your turn. It's up to the state to decide who's considered a frontline essential worker, the next people up for the shots. Madeline O'Neill spoke with state health officials and hospitals to learn where you are in line and what goes into making those decisions. Maddie?
Well, there are actually 3 parts in this first phase of vaccine distribution, 1A, B, and C. Currently, we're in phase 1A. That includes the about 450,000 healthcare workers in our state, along with long-term care facility residents and workers. Now, we don't have to completely finish phase 1A before moving to phase 1B, which will include more groups, and we're getting closer to that by the day.
I'm ready.
You don't often hear this said about shots.
It feels really good. It feels really exciting.
But once the COVID-19 vaccine goes into healthcare workers' arms, it takes weight off their shoulders.
I don't have as great of a fear of, bringing something home to my family.
Dr. Allison Schwartz is one of about 7,000 SSM health workers who have gotten their vaccine since mid-December, all who want them, according to VP of Pharmacy Services, Mo Karbat.
We feel that, we did what we had to do to protect ourselves so we can protect our patients as well.
Karbat says they're now moving on to offering vaccines for healthcare workers from more than 100 unaffiliated healthcare organizations, like independent practices, pharmacies, and dental offices.
All right, you're all done.
That's it?
All part of phase 1A.
Thank you for your help.
We are not in short supply when it comes to the vaccine.
UW Health has started vaccinating about 75% of its 13,000 workers as part of phase 1A. The health system joins SSM Health as vaccinators in our state, setting their sights on an imminent phase 1B.
When we get direction from the state on what that pool is going to be, how do we quickly get them through our process, get these vaccines out of our freezers into people's arms?
By the end of January is when we believe we will get to a point, a large percentage of 1A healthcare workers in the state have been vaccinated, and at that time, we will hopefully get the green light to go to 1B.
Early this week, the Wisconsin Department of Health Services expects to get final recommendations on who exactly should be included in that 1B category from the State Disaster and Medical Advisory Committee.
We're trying to balance this implementation feasibility versus the ethics.
It's a group of experts parsing out who will be next in line. DHS has final say, but in the committee's latest meeting Friday, most agreed to move forward recommending that phase 1B include first responders, educators, correction workers, those in mink husbandry, and congregate groups including people who are incarcerated, along with adults 70 and older.
So as the group has thought about populations, they've really focused on who is most vulnerable, who is most at risk. What essential services do we need to make sure are in place?
Those recommendations as they stand would leave public transit, grocery store, manufacturing, and other essential workers for phase 1C, which would likely include those with high-risk medical conditions as well.
Depending on our supply of vaccine, which is the limiting factor in everything, it will take a similar amount of time to get through phase 1B before we're ready to open phase 1C.
Anyone not included in phase 1 will be part of phase 2, which health providers estimate may take us into the summer. At SSM Health, Schwartz just got her second dose and has this message for everyone waiting on their first.
Well, that things are happening, and I think they're going to continue to ramp up as we move into this new year. And hopefully, as we look towards spring and summer and fall, people are, anxious for some return to normalcy.
All right, have a good day.
You as well.
Thank you.
While hospitals and local health departments don't want you calling asking when you specifically will get your vaccine, Schwartz says if you do have any questions or concerns about the vaccine itself, feel free to call your healthcare provider or visit the CDC's website. Now, the state's Disaster and Medical Advisory Committee will be meeting early tomorrow to talk about some of the recommendations for phase 1B. Once those are finalized, they will be open for public comment as well.